Hey, y'all. Welcome to another episode of Confessions of a Male Gynecologist. I'm your host and your guide, Dr. Shawn Tassone, middle name Anthony. The Hormone Balance Bible. You should go get that right now on Amazon. It tells you all you need to know about hormones, or you can just listen to all the episodes of Confessions of a Male Gynecologist, where if you've been a listener for some time, you realize that I don't like to stray from the controversial, and I'm not afraid to go against the mainstream. But there's been a question that I've been getting a lot lately, and it causes a lot of confusion amongst patients and probably doctors alike. I mean, the doctors that are actually in the industry, not so much, but the doctors that maybe don't dive too far outside the box. And that's the difference between synthetic versus bioidentical hormones and what that means. Now, to just make it super easy for everybody, to make it super relatable, what we basically mean when we throw those two words around, bioidentical usually means that it looks similar to the body's hormones. So if you were to use the lock and key analogy, the lock being the receptor in your cell, your body has the ability to make a hormone that it fits exactly into that keyhole. Bioidentical. Looks like your body, bioidentical. When we talk about bioidentical hormones, we mean hormones that are structurally similar, meaning they fit that lock similar to the way your body hormone fits that lock. A synthetic hormone, for the use of this lecture, if that's what you want to call it, means it's structurally different. So they might change one little hydroxyl group or a methane group or a carbon group. There's something that has changed inside the structure, so it still can trigger the receptor, but it doesn't fit exactly. And the problem is, when you don't hit the receptor exactly, you don't really know the response that you're going to get from that chemical. In most cases, the chemicals are much stronger. They hit the receptor much harder. And so that's what we usually mean. That's what I mean when I talk about bioidentical versus synthetic. Now, if you want to break terms down, and my colleagues who like to be assholes will do this to you, they will say synthetic means that it has to be made. That's synthesis. That's what it means. You synthesize it, you make it. And technically, the bioidentical hormones have to be made. They come from wild yam and they come from soy. So theoretically, they're all synthetic. They all have to be made because they're not naturally occurring in your body. And that's what the assholes will do. They'll just bring that up. Oh, they're all synthetic. Well, and then what NAMS has done, and I want you to go back and listen to my podcast on the North American Menopause Society, because they can't use the word bioidentical because it wasn't something they thought of. They have coined the word body identical. It's the same damn thing. They just had to use their own word. So for the purposes of this talk, bioidentical means looks similar to your natural hormone. Synthetic means that it doesn't look natural to your body's native state. They both have to be made. Most of them are made from soy and yam. However, we know Premarin was made from pregnant mare urine, just the word Premarin. And usually the reason that they make them synthetically, or that they make them look different, is because they can patent them. You cannot patent estradiol, estrone, estriol, progesterone, or testosterone. The reason you can't patent it is because it's a naturally occurring compound. It occurs in nature. You can't patent it. You can patent something that you've made in a lab, though, that looks structurally similar. That's why we have synthetic hormones. Really, it's about patents and money and things like that. That's why it exists. So what I want to do is take a trip down bioidentical history lane, and then briefly talk about the differences between the bioidenticals and synthetics so that you kind of have an understanding of what we're talking about when we talk about these kind of hormones. And suffice it to say, it's confusing to some physicians, so I'm imagining it's confusing to some patients. You will hear things bantered around like bioidentical hormones have only been in existence since the 60s and whatnot, but they have actually used hormones for thousands of years. There's recordings, ancient China, um, where they talk about women who lived into that menopausal age range who used to use the urine, or they used to drink the dried urine crystals or eat the dried urine crystals of younger women to counteract, they didn't call it menopause, but to counteract some of the symptoms of the menopause. And that makes more sense than drinking the urine of a horse. And what's fascinating to me about that is that our ancient ancestors, at least those in China, knew that there was something in that urine because you do urinate some hormones, but they didn't go looking for horse urine. That's just stupid modern aged Americans that did shit like that. Because you could patent it. You can't patent regular old urine. So what's fascinating about that is that we patented horse urine, but the truth is that you can't patent that aspect of it. So they had to go, and we actually made horse urine eventually. So that's beside the point. I just thought that was fascinating. Modern times, research and development of the equine hormones, the Premarin, started around the 1940s and basically was the modern revolution in hormone replacement therapy. I remember a cover of Time magazine years ago where they touted Premarin as the fountain of youth, and every woman was put on Premarin, and then a bunch of women got uterine cancers because they didn't have the protective effects of progesterone, because obviously we didn't bother to study it in depth. But anyways, they basically describe this kind of oral conjugated equine estrogen. That's a synthetic. That's a non-bioidentical hormone. We instead of calling them synthetics, we should just call them non-bioidentical hormones, because that's what they are. But basically, they were mass marketed to help the estrogen only replacement women. That was popular basically until the 1970s, when we started noticing that women who were on this conjugated equine estrogen, this Premarin, were starting to get uterine cancer. The popularity of Premarin then plummeted because, who wants to get cancer? And so what the observation then was, because scientists are smart and they figured it out, that they caused a problem. Now they had to fix the problem, was that endometrial cancer was not a significant occurrence in women whose ovaries produced both estrogen and progesterone. Obviously, there's something to balance. So those doctors out there that say hormone balance isn't necessary are full of shit, because obviously if you don't have a balance of your estrogen and your progesterone, you're at higher risk for uterine cancer. So basically, they then came up with a synthetic form, or a non-bioidentical form of progesterone, that was basically developed in the 1980s to balance out the effects of this conjugated equine estrogen, and this was called Prempro. In the late 80s, they figured out that you can micronize bioidentical steroids, meaning you could micronize actual progesterone, and then this progesterone was absorbed well orally. Estriol and testosterone were also figured out to be available, but they went at those through a transdermal route. So we've had micronized progesterone, or bioidentical progesterone, for decades, since the 1980s. Micronized human progesterone became available in Europe in the late 1980s, in Canada in 95, and then our USDA, because we are slow, approved it in 1998. And 1998 for me was when I was finishing residency, so it was kind of a great thing to have this. Didn't know much about it, to be perfectly honest, at the time. Was using Prempro. But it's been available. That was when it was commercially available, and because it was made by a company called, in the the medication itself was available through regular pharmacies like CVS and Walgreens, and it could go through your insurance. But it wasn't covered in most cases because it was new. Estrace was also available, or micronized estradiol was available for decades as well, but it wasn't covered by insurance because Premarin was covered, so they didn't cover the bioidenticals. But what it did was, when they micronized it, they enabled it to be released slowly, and it was better absorbed and by different routes, other than used to be that you had to take hormones through intramuscular injections in the 1930s. However, they then developed this micronized form that you could take orally, or that you could put on the skin and basically use it along those lines. So that's kind of a down and dirty of just generalized hormones. We do know through studies, though, and the recent study that I talked about last week that shows the benefits of bioidentical hormones. Synthetic progestins, though, the synthetic progesterones like medroxyprogesterone, levonorgestrel, norethindrone, things like that, tend to increase low-density lipoproteins, bad cholesterol. They decrease good cholesterol, and they basically decrease sex hormone-binding globulin. It can cause compliance issues due to the side effects. I can tell you that Depo-Provera, or medroxyprogesterone as a birth control agent, is probably one of the worst medications ever used. I simply refuse to use it. I maybe have one patient that's on it, and it's only because she's going to get pregnant if she doesn't use it, and she insists. Not a big fan of the progestins, and I'm not a big fan of the synthetic estrogens as well. Mostly the largest non-bioidentical estrogen that's used is ethanyl estradiol, which is what's in birth control pills. Bioidenticals, let's talk about bioidenticals real quick. Bioidentical HRT is basically referred to as natural. Natural is kind of a weird word. It has a lot of positives and negatives attached to it. Natural basically to me means that it's made in nature, that it's found in a natural state. That's why you can't patent it. But basically, the natural part means that it can be functionally made from organic materials. And bioidentical hormones are usually derived from a type of plant called diosgenin. And it's very similar in chemical structure to our own precursor steroid cholesterol. So we make our hormones from cholesterol. You can make hormones in a lab from diosgenin. And basically, it's an oil. Diosgenin itself is chemically altered in a lab to exactly match the progesterone or the estradiol. Now, what's interesting about that, and I talk about this in an earlier episode of my podcast as well, see a trend here, you can't use wild yam cream that has this oil in it because it doesn't have progesterone or estrogen qualities. You can't do that conversion in your body. So therefore, you cannot make this hormone in your body. You have to do it in a lab. So these creams are basically a complete waste of money. So basically, the steroids that you can make, the steroids that are basically broken down into 5 categories: the estrogens, estradiol, estriol, and estrone; progesterone; the androgens, which are DHEA, testosterone, androstenedione; the glucocorticoids, which are cortisol and cortisone; and the mineral corticoids, which is aldosterone. So there's those 5 types of steroids, 5 categories of steroids. The female body produces the 3 estrogens, and they all have very specific roles. Estrone itself is a proliferative estrogen, and it comprises about 10% of the total estrogens premenopausally. Estrone is usually also the estrogen that is responsible for cancer effects because it can be broken down into a product called 4-methoxyestrone, which is classified as a carcinogen. Along a different line, though, it can also be broken down into estriol and estradiol. So it's one of those things where you have to look at what you're doing with your estrogens and how you're processing them, especially for women that have a strong family history of breast cancer. So then you have estradiol, which is also a proliferative estrogen. It causes the thickening of the lining of the uterus, and it's the most potent of the estrogen family. Basically, it's another 10 up to 20%. So you have estrone, that's 10%, estradiol, that's 10 to 20%. Estriol is the weakest of the three. It's not a proliferative estrogen. However, it is also the weakest of the estrogen. It's usually made in high quantities when you're pregnant. The concept that some doctors will put a patient on Biest, which is a combination of estradiol and estriol, is this concept that if I put you on a proliferative estradiol, then I want to put you on this non-proliferative estriol. The problem with estriol is it's so weak that it also can block the estrogen receptor, or it can glom onto the estrogen receptor like estradiol can. The problem is it doesn't really exert an effect. So it basically, in effect, blocks the estradiol from getting onto the receptor. So when you give someone Biest, you're kind of counteracting the effects of the good estriol that they could get those benefits from. That's why I don't use Biest. Basically, all these estrogen hormones, estriol, estrone, and estradiol, they all use the same receptors. However, as I said, they have different affinities. Estradiol has the most potent and is converted then into the weaker form of estrone. And then estriol is basically under the influence actually of progesterone. So bioidentical hormones usually can be compounded. You have them made in a lab, and they're sold in different compounding pharmacies. There are commercially available bioidentical hormones. Actually, I would say most of the hormone replacement therapy currently on the market is bioidentical. The patches mostly contain bioidentical estradiol. You have estradiol generic 1 and 2 milligrams. You have micronized progesterone. Testosterone is not commercially available for women, which is a damn shame, but it's not. And you have these compounded hormones. Now, the difference between the two, when you hear doctors tell you that bioidentical hormones are not FDA approved, what they're wrong, because they are FDA approved because they're used commercially in all these hormone replacement therapies. What they are meaning to say, and they're being a little bit deceptive here, is the hormones themselves are FDA approved. What they mean is that the compounding pharmacy where they're made is not FDA approved. The FDA does not go around approving pharmacies, but the drugs that the pharmacies are utilizing to make the bioidentical creams and the sublingual tablets and the capsules is FDA approved. It's just that they're man-made and they're not regulated in the same way. So what they should say is the compounded hormones aren't FDA regulated, but the hormones are FDA approved. So I want to dispel that myth. The hormones themselves that are compounded are actually FDA approved. What's not FDA approved is the actual pharmacy, and that's because pharmacies aren't FDA approved. So they're being a little bit slick when they tell you that. But they basically, are kind of lying about things. So what happened with the politics of hormones? Because actually hormones are quite political. In the late 1980s, the company that made Premarin, Wyeth Ayers, basically they patented hormone replacement made from pregnant mare urine. They called it Premarin. Using young women's urine, although available and cheap, was not a marketing thing. So to have a bunch of young girls peeing in cups and then breaking that down into estriol, estradiol, and estrone didn't seem super marketable because, God forbid, we use a horse's estrogen, but we don't use a human's estrogen. It's the same kind of fallacy I talk about when I go after the companies that are marketing colostrum as this great superfood, because if colostrum was needed outside of infancy, colostrum is that, I'm getting sidetracked, but I got to do this. Colostrum is that clear fluid that comes out of the breast the first few days to a week or so after a woman starts lactating, full of immunoglobulins and a lot of great stuff for the baby. If we as humans needed that more than out of infancy, then why wouldn't women continue to make it? Because that's evolution. So we obviously don't need it. And then if we did need it, let's say we did need it, then why would we need the colostrum from cows? why wouldn't we need the colostrum from humans? Well, again, nobody's going to go around drinking human colostrum, just like we don't go around drinking human milk. It's all marketing. We don't need cow's milk. It's not a need. Some people like to drink it, and it's fine to drink. It has a lot of allergic aspects to it, but we don't need it. The milk industry is huge, and I'm getting sidetracked again, but their lobby is massive, and so they've spent a lot of money on those commercials, the milk mustache. So anyways, Wyeth went in and they started using pregnant mare's urine because they didn't want to use human urine, and they couldn't patent human urine, so they had to go for a different route. So they basically went about getting this drug produced. They patented it, and the companies went public. Basically, what happened was, obviously, when you patent a medication, you want to make money. And they basically went all out and basically told women, as I said, the magazines and everything, the marketing was that it was the fountain of youth. And Premarin for about 30 years was marketed to millions of women as the best way to just basically fix menopause and even prevent cancer, heart disease, osteoporosis. And then they started finding out that this unopposed estrogen that we were giving women caused cancer. So, that's the horrible history of it. Basically, we found out that we needed to add progesterone, which then they made a fake progesterone, called it Prempro. And then the shitty Women's Health Initiative happened in 2002. And I have a complete episode on this. I'd love for you to go back and listen to it. I also, last week, talked about the newest article that came out that followed 10 million women that showed that actually estrogen can be cancer protective for breast, lung, and colon, as well as for dementia. So the Women's Health Initiative really screwed an entire generation of women, and it kind of screwed an entire generation of doctors because we believed that estrogen was cancer causing. We believed that it was horrible for women. And I was practicing in Tucson at the time. I remember this because in one day I had hundreds of phone calls with women wanting to go off of their hormones all of a sudden. And really the data just never really came out to show much. So basically we have these issues where bioidentical hormones got our hormones in general got a bad rap. But in October of 2006, kind of a pioneer, Suzanne Summers, rest in peace, pushed the envelope a little further and published a book called The Sexy Years. And while Miss Summers was an avid proponent of bioidentical hormones, she kind of brought that thought process to the forefront. They'd been around, but they weren't really talked about. And Miss Summers did actually do a service in bringing those to the forefront, being diagnosed with cancer and then being a champion of using bioidentical hormones. Wyeth and the North American Menopause Society at that time, which was an association that was almost solely sponsored by Wyeth, ding, 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 follow the money, the North American Menopause Society is a scam. They basically retaliated through the American Medical Association. So basically, they used the American Medical Association to basically support Wyeth. So the American Medical Association, who I also think is a scam organization, I've never been a member. They're basically pretending to represent doctors, and they probably represent 5% of the physician population. The AMA basically passed a resolution in support of Wyeth asking for more regulation from the FDA in the area of compounded bioidentical hormones. But fortunately, the United States Congress rejected the FDA's regulation and requested that Wyeth stand down. And these are the facts. Bioidentical hormones are medications. They're not natural products. Bioidentical hormones are medications. They are not natural products. They're manufactured by drug companies from soy and yam. They are medications manufactured by drug companies from soy and yam. The only natural thing about them is that their molecular formula looks similar to what you have in your body as a woman. Basically, the medical schools aren't teaching this, and patients think that these are natural because they come from plants, but they're medications. The term bioidentical is not a marketing term. My colleagues that are idiots will say this. They'll say it's a marketing term. It's not marketing. It's a descriptive term. It means it looks like the body. That's why they use body identical, because in their infinite wisdom, they can't use bioidentical because they are still, from the days of the 1980s, they're still fighting. They're still fighting against these hormones because they're not made by big pharmacies. They are more and more now, but they weren't back then. So the term bioidentical is not marketing. It's a descriptive term. It describes the biologically identical molecular structure. It's a term that makes the important distinction between a bioidentical hormone and a non-bioidentical hormone. So conjugated equine estrogen is non-bioidentical. We can say non-bioidentical and bioidentical. Bioidentical estradiol, progesterone, and testosterone, as I said, are FDA approved. Estradiol and testosterone can only be obtained by prescription through a licensed medical practitioner. Although there are scammy companies out there selling on Amazon that call it face or skin cream, like Una, like these companies out of Australia, and they will market it as a face cream, and you can actually hurt yourself using these creams. I would strongly recommend you not use them. Bioidentical estradiol and progesterone and testosterone are all available with a prescription, and they're all FDA approved. Bioidentical hormones are also commercially available from pharmaceutical companies, with the exception of testosterone, in formulations where patients can get the same transport systems such as troches, gels, patches, and creams. Now, sometimes you have to have them made in a compounding pharmacy, but pills, patches, and gels and creams are available commercially through your big pharmacies, CVS, Walgreens, etc. Some of the drugs that are using bioidentical hormones: Vivel, Climera, Estroderm, Estrace, Prometrium, Androgel. Androgel is a topical testosterone. I don't think women should use it. The doses are way too high. They're not for women. They're dosed for men. I wouldn't use it. They're commercially available. Basically, what we're doing is we're demonizing the industry of compounding pharmacies, which I think is wrong. The last thing, and I don't have to belabor this point because y'all realize, the pellets, hormone pellets, are also promoted to women by saying they are bioidentical, and they are bioidentical, but they're not safe. I wouldn't use them. So basically, what I wanted to do, quick and dirty, was to run down the differences between synthetic and bioidentical. Keep in mind that, to me, synthetic just means they're not bioidentical. Synthetic means they don't structurally look the same as your natural hormones. They don't fit your receptors the same, and that's why they can cause complications and have increased rates of cancer and things like that. Bioidentical hormones are commercially available through your insurance. The downside is you usually only have 1, 2, maybe up to 4 different types of dosing. So you can't be as specific in occasion, and you can't sometimes mix the hormones. Estradiol patches do not contain topical progesterone. They contain a progestin. That's why I don't use combi patch. However, you can use straight estradiol, you can use micronized progesterone or Prometrium, and you can use DHEA. That's not even a prescription for some reason. If you wanted to combine hormones, like I'll sometimes put estradiol, progesterone, testosterone, DHEA, all in the same cream, then you have to have them compounded. And lastly, I want you to remember that when doctors say that bioidentical hormones are not FDA approved, they're talking out the other end of their ass, because, as if there is another end. I guess it is. That's your mouth. That what they're saying is the compounding pharmacy isn't FDA approved, but the bioidentical hormone itself is. So I just wanted to put that out there. I don't want to talk about it forever because it's a little sciencey, a little boring, and I hate to be boring. But I wanted to talk about this because I talk about it a lot on Saturdays when I do my Q&As. I hope this was clearer than muddy water. I hope you all have a good day. And if you have any questions, reach out to me on Saturdays on Instagram at Shawn Tassone MD. Have a great one.